Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and a lot of you are really enjoying doing Invisalign, and you're getting a little more daring with your Invisalign, and you're saying, but a lot of you are afraid to treat kids and teens. And a lot of you are asking, like, what are the warning signals? What are the warning signs? What cases could get worse? What cases should I still always refer? And it's hard to fit this all into a nice bucket or box, but I'll just kind of unpack my thoughts and give you some suggestions. So, for example, first of all, you need to know the skeletal age of your patient. So, have they gone through puberty? Are they still growing? Obviously, we still grow a few years after puberty is done. Boys, a little bit more so. Boys can grow up to age 18, 19, 20, especially if they have a late mandibular growth tendency or an open bite tendency or a long, steep facial height tendency. Girls maybe to 15, 16, you need to know all this. So unless you understand the concept of growth modification, how to read a Ceph, how to understand a Ceph, how to understand Ceph numbers, how to read a hand wrist x-ray. And by the way, I have lots of information, videos, monographs on all this stuff if you ever want to know it, et cetera, et cetera. How to, unless you're comfortable with all that, and it's something you can learn, you really want to stay away from class 3 patients, okay? So class 3 patients, like this guy, like her. Class 2 patients should be fine, but again, it is below standard of care, in my opinion, to do improved on teens. If you don't know how to fix that overjet, don't take the case. And if they're still able to grow, I think you have no business extracting teeth. That should always be a last case scenario in growing kids and teens. So if you're not comfortable with growth modification, growing a lower jaw, don't take that case, okay? Stick with class 1 cases. But remember, class 1 cases in a 12-year-old could still, the class 3 tendency could still outgrow, or with an open bite tendency. They may still outgrow. So you need to know how to look for certain things, which is why Cephs are really important in growing kids, I think. So stay away from open bite cases, stay away from class 3 cases, and stay away from class 2 cases unless you know how to fix it. But all of this you can learn how to fix. It's just maybe a little bit more advanced. So hopefully that was helpful. Thank you.